So I mentioned these points, the goals of suicide prevention, and in just a minute or two, we're going to stop and see what questions we might have. But I want everybody to see these goals. Assist survivors. And by the way, when I use the word survivor in the literature, it really means somebody that lost a loved one or a close friend to suicide. So I'm not talking about someone who survived a suicide attempt. Although there's really good news. The good news is the research says that those that survive a suicide attempt, like 90% of them never go on to die by suicide. So that's very hopeful for the future. How about this phrase, strive to treat all the deaths the same, regardless of cause of death, regardless of popularity, regardless of socioeconomic level. Identify and refer individuals who are likely now more at risk following the suicide. Provide accurate, truthful information while still trying to minimize the risk of suicide contagion, always focusing on the future. One of the great debates, though, is this. Do I share what method he used to die by suicide? You're going to find some people that say, never, ever share the method. Well, my experience has been many times the students already know the method. So I might just acknowledge, yes, it was a gun. Guns are used in only 5% of suicide attempts in America. They result in 55% of suicide deaths. But we're not going to dwell on gory details or what caliber gun or did he die immediately. We just want to say, yes, it was a gun, and keep putting the focus back on how can I help you and how can we get everyone at the school and the community involved in ongoing prevention efforts. So Kim or Sally, do we have any questions anybody has asked?
So in the Q&A box right now, there's a couple, if you don't mind if we go back to those for a second.
Sure, go ahead.
One person is asking about what happens when you do the right things, you get help for that student, you've done all kinds of things, and then that help doesn't work. They're back, they're still struggling, they're still having suicidal thoughts. So they're asking, what would you suggest in those situations?
Well, it's not unusual for kids to keep having suicidal thoughts. We need to follow up as much as possible. When parents sometimes say to me things like, oh, she is so much better now, I don't think she needs any more counseling. I might be pointing out, well, what's she going to do the next time there is a precipitating event? I don't agree with you. We want to make sure they still have a written safety plan. We want to continue to try to remove lethal means. I think I talked last time about my latest project is basically a tool for suicide proofing your home. And I don't know if I've sent it, Kim, but I definitely will send it. And you know what my great debate is? Obviously, I believe we need to go over with the caregivers how to suicide proof their home. But now I'm thinking, should I ask parents to sign that they've been given a copy of how to suicide proof your home, which largely focuses on locking up medications, locking up guns, removing or locking up sharp instruments. I can tell you where it gets really complicated. That is, can we possibly get rid of every belt or every rope? That's going to be a little more challenging. And then, imagine that we believe a kid is suicidal. Well, I'm going to be saying to parents, I don't think they should be driving a car until you get community-based treatment, and they'll help you figure out when it's okay for your kid to be driving a car. Over 49,000 suicides a year in this country. That's probably an underestimate pretty dramatically, because a lot of suicides do involve a single car accident. The literature says only about 25% of the time did the suicide victim actually leave a note? And then you have coroners around the country that say things like, the kid's under 12. I'm never going to put it down as a suicide. So follow up at school, follow up with the students, continuing to push families to get community-based treatment. And maybe they need to go to a different treatment provider if it doesn't seem to be really working or meeting the needs of the students. Do you have any other questions, Kim?
One comment that came up was that they coach parents to tell community mental health agencies that their child has suicide ideation or risk, so they don't end up waiting on waiting lists so long. And it's really difficult because here in Nebraska, we have so many, we're limited in how many providers are out there even, and people end up being on waiting lists for a long time. Do you have some suggestions on that?
You know, this actually came up this morning in a meeting because we have a student counseling center on campus, and it's free, but there's often a wait list. And how we can do something to make sure somebody's name goes right to the top. Often the family's got to drive their kid to the emergency room. And when they're going to an emergency room, I'm probably going to say something like, ask for the psychiatrist on call, okay? What the problem is, very often, a kid's turned away from an emergency room. Oh, they're not that suicidal at this moment. I mean, it's like, frankly, we're not very good at actually predicting the level of suicidal severity and who might actually take action. I believe strongly in suicide prevention task force. And the question would be, could a county in Nebraska form a youth suicide prevention task force and involve mental health personnel and medical personnel, school personnel, and be looking at some of the challenges? The challenges are really all across the country. I think we've got to attract a lot more people to the field of mental health, especially for being a mental health professional in the schools. And I think the only way that'll ever happen is if, like, there's free graduate tuition. You go back and become a licensed professional counselor, for example. So there's a shortage nationally. And I think my best advice would be get some dialogue going in your school and community about the challenges you face and what might be some slow progress to being able to reduce that waiting time. Okay. I guess I've pretty well given this one away. The principal wants to hold an assembly about the suicide, but they might not want to take my word for it, right? Well, if you were to look at the After Suicide Toolkit for Schools on page 30, with the most recent version, we got it written down. And here's the bottom line. I believe a school administrator is foolish for not following the recommendations in that toolkit. They leave themselves open for incredible criticism. I mean, let's look at the source. Suicide Prevention Resource Center, American Foundation for Suicide Prevention. Last time I shared with you, for the most part, school administrators are not well trained in suicide prevention, intervention, and postvention. So I think by not following the toolkit, refusing to look at it, for example, they are making a very big mistake. And people on the webinar today need to have the toolkit, need to be as persuasive as possible about, we really need to look at and follow these recommendations. So I had to do this many times. So I'm a big believer in calling trees. So you call everybody that works at the school tonight and you tell them about the meeting we're having at 6:30 tomorrow morning before school. And by the way, one of the suicide victims was a swimmer. You know how early swimmers get to school on the high school team? Try 5:30, because that's when we were there to talk with the kids on the swim team. And one of those kids actually became a literary college professor. And he wrote a book about what it was like at age 16 to lose a classmate to suicide. And in the book, he says something like, the psychologist that day with the swim team, it helped. It started us on at least the right path for all of our complicated emotions and thoughts. So what do I like to say to school staff in those meetings? First of all, we want them to be told the truth. The principal isn't telling them the truth. In fact, I wasn't really asked to speak yet, but I stood up and said, we talked to the police. The police said, yes, it was a suicide. We need to tell the truth about this. The principal wasn't too happy, but I am a big believer in telling the truth. I also remember something that his girlfriend told me. He tried to hang himself a week ago and the rope broke. Now, I'm not going to make her feel any worse than she already feels, but you see how frustrating it is to know that he tried a week ago and she knew that and didn't look to adults for help. I also believe strongly that we need to tell school staff in a meeting like this, today, it's going to go better than you ever thought it could, because we're going to work on helping each other, and you're going to be in a better place to help students. The day will go better than you could have ever imagined. And I see a lot of strength in this room. You all got into education because you care about students. And maybe the simplest advice is let your heart be your guide. In your heart, I think you have pretty good ideas about how to help kids. We need to put an arm around them. Let them have a chance to talk about it. Let them have a chance to write about it. And it's almost like the younger the kids, the more we're talking markers and poster board and drawing and putting things in a card for his family. And the older a kid is, the more we're talking about making a difference in the world. I don't know if you've heard this phrase before, but I really like it. The gift of hope. A truly wonderful thing about adolescents is they want to do things to make the world better. Whether we're raising money, whether we're raising awareness, whether we're marching in the local Out of Darkness walk to raise money for the American Foundation for Suicide Prevention, they feel better when they can get involved and do something that might just save a life in the future. It makes me think about back before we had, such available crisis hotline numbers and text line numbers. So one of the Cypress Fairbanks schools had several suicides, and the students were like, we want to start our own crisis helpline. So we had like 30 students. We put them through extensive training, and several nights a week, we had hours from like 7 to 10 where kids were calling and talking to their peers, but the adults were sitting right next to them. And I remember some of the teachers were like, I can't believe you're going to do that. You're going to put a high school kid in the position of responding to somebody that might actually be suicidal. Here was my response. They're in that position every single day. We're putting them in that position after they're trained, and I'm sitting right there in the same room when they're talking on the phone. But I remember one kid saying, I believe we did it for 4 or 5 days in a row. And I remember a kid saying, do you think we saved any lives? And I'm like, well, that would be really difficult to know. But you learn some skills that you can carry with you and use for the rest of your life. You might need it with a college roommate. You might need it with a coworker on the first job after college. You might need it with an elderly neighbor. You learn some skills that are always going to stay with you. Teachers need a chance to ask questions. They need to be encouraged. They need to be supported. They need to know what are the typical reactions a kid has to a traumatic event. They regress academically and behaviorally. They have nightmares and worries about the future. They have sleeping problems. Those aren't the unusual. Those are the pretty much every single kid has one or more of those. And so what's the message for school staff and for parents? Be patient, be tolerant, be structured, keep up the routines, and be loving. And hopefully all the adults are modeling coping with what is going on. And this example, I just shared it yesterday. Walked into a biology classroom. Students are openly weeping. Everybody is zeroing in on, there is the desk that Tyler would have been seated in if he had not died by suicide last night. The teacher came up to me. She says, Dr. Poland, you want to talk to them before or after their biology test? I'm sure my mouth dropped open. There can be no test today. Look around you. Tyler was in this class. Kids are openly weeping. I can't take your word for that. I team teach. I would fall behind the other biology teachers. Fine. Go ask the principal. So I am sure he will tell you no test in your class today. Does that mean you cancel all the tests in a high school of 4,000? No, but you'd cancel it in a number of classes. Would you cancel all the tests in a high school of 400? Yes, because probably everybody would have known Tyler. And I've tried to be very specific since that day, making sure that the communication that goes out to teachers clearly says no tests in certain classes. You have the opportunity to visit with the family of the suicide victim in their home. You could call first, although we haven't always done that. We basically just get in a car. We've got the address, right? I remember Phyllis, a middle school principal, saying, she stopped in a grocery store and we're on the way to the home. And I'm like, Phyllis, what are we doing? She said, Scott, we're not going to the family empty-handed. We're taking food. We knocked on the door. They let us in. They've let me in every single time. We, as a society, maybe aren't exactly great in reaching out to people that have just lost a loved one. But if that death was a suicide, we're probably especially reluctant to reach out. And we're always worried about saying the wrong thing, right? Well, what's the right thing to say? I'm so sorry about your loss. I'm here to help in any way I can. I am here to listen. And by the way, the two words that I rarely use, I understand. Could I understand, really? Not unless something like that happened to me. And clearly in this work, I freely and easily share I'm a survivor of my father's suicide. So maybe that's one of the things that helps me get entry with these families at, arguably the darkest moment of their entire life. But it's really about listening and just sitting down, being with people. And if they want to talk, we listen. And even saying things like, I can't imagine going through that. I can't imagine how hard that is. I'm sure you're not the only one that has some of those thoughts. Okay, the family tells the school they may not disclose that their child died by suicide. So there are sample letters in the AFSP SBRC toolkit. But let's zero in on this one. It basically goes like this. The family has asked that the cause of death of their child not be disclosed. But it is important that we all know that suicide is one of the leading causes of death for young people. And there are certain things we all need to look for, to know and do to prevent suicides. And I remember a school board member in Georgia saying, we couldn't possibly send that letter. Well, I think it's important that you review the sample letters with the crisis team, and then you are going to decide. But too often we handicap the school mental health professionals. So I've been invited now to 17 communities that have experienced a youth suicide point cluster. And now I'm about to talk to a small group of student leaders at the affected high school. And up comes the superintendent. She basically says something to me like, well, we're really glad you're here, but you're not going to use the word suicide, are you? And I said, I am going to use the word suicide. This is a small group of students, and they know that there have been multiple suicides this year of students that attended their high school. We must use that word. Now, a superintendent came around, she sat, she listened. Things went probably much better than she ever would have expected. That got me a chance to have an audience with the school board. And the audience with the school board enabled me to make the recommendation that suicide prevention needs to be somebody's job. That was a district of 70,000 in Utah. So they made suicide prevention someone's sole job. In a small school district in Kansas, Nebraska, South Dakota, it probably can't be somebody's sole job, but it should be really clear. This is a major part of their duties. They are our suicide prevention expert. They are doing trainings. They're being sent to trainings around the country to make sure their expertise is the best possible and the most current. So I've had good luck with this. And I think this is what we need to do. I gave the example earlier of a surviving sibling. And if nobody talks to that sibling, and they're probably going to be out of school for 3 or 4 days. By the way, what do you say to somebody who's coming back to school after the suicide of their sibling? So you meet with them. But maybe most importantly, you meet with their teacher, you meet with their classes, and you say something pretty simple like, when they're coming back, their emotions are probably going to be pretty raw. Let's not pepper them with a lot of questions. Just say something like, we're sorry it happened. We're here for you if you want to talk. And a few times teachers have gotten like way overboard. So another high school example. And some of these, frankly, I could not make up. So here it is. I'm trying to help the sibling who lost her older sister to suicide, same high school. The one who said she was walking on eggshells. So she calls me up and she says, I walked into 10th grade health and all of a sudden the topic was suicide prevention. Doesn't the teacher know what happened to my sister? I felt so, much like I was on the spot, everybody looking at me. So I tried to reach the teacher. I couldn't. I reached the school counselor who went to the teacher and basically encouraged her to give the surviving sibling a choice. Like, this might be really hard for you to be here today. And we are going to talk more about suicide prevention, but it's your choice whether to be in class or not. So the student called me that afternoon. She said, well, the teacher gave me a choice about whether to be there or not. And I said, no, I'd like to stay. But then the teacher went too far. She said, I understand your sister left a suicide note behind. Could you bring that in? That'd be really interesting for the class to have a chance to read. So it's like, what in the world was that teacher thinking? And these are the kind of things that happens when we don't train the entire faculty. And I'll give you one more example. A teacher thought the kid was suicidal, didn't walk him down to the counseling office, sent him out to see Madam So-and-so on the highway, who was basically a psychic, okay? So this is why we need a lot more education for school personnel. So what do we say to students in the classroom? First of all, I want to make sure I have all my facts, because I didn't know the student right. In reality, it's best when the school counselor is with me, because hopefully the students in this affected class know their school counselor. But I've often found, for whatever reason, people either don't want to be in that classroom with me, or if they're in the classroom with me, they don't really want to say much. They want to, let me just sit in the back and observe, okay? So if the student had a nickname, I need to know it. Because the first time they realize I didn't get something quite right about what happened or how she was called in class. But I might just begin with something like this. You know, I didn't know your classmate, Nikki. I'm really sorry about her suicide. I really would like to know more about Nikki. Where was she seated in this classroom? What was she working on? Any of the artwork in the room? Did Nikki do any of that? And at the simplest level, you know what we want to do in the aftermath of someone's death? We just want to have a chance to talk about them. We want to keep their memory alive. That's what these parents want. That's why they start all these foundations. They're doing things in memory of their child and just providing kids a chance to talk. I mean, pretty soon they're going to start asking questions like, why did she do it? Why did she die by suicide? We're never going to know why. The answers died with her. We could talk in generality about some of the factors in youth suicide, but we really never will know. This is very sad, very tragic, but the focus really is on helping all of you and preventing further suicides. I've already talked about their second question is often, what method did she use? I have found it best to quickly state the method. Then we keep getting back to, how do I help you? And here's the next question. Why didn't God stop her? I don't claim to be a religious expert. Our son is a minister, but I want to share with you an approach that I recommend for clergy and an approach that I learned from a number of members of clergy. You're wondering why God didn't stop her. God couldn't stop her. God has embraced her, yes. And whatever afterlife you believe in, God's actually sad. God wanted her to stay on this earth and do God's work over her natural lifetime. So do you see why I like that so much? Embraced in terms of whatever you believe in, but not giving the impression that God chose her to come to God at age 15. And I'm going to give one more example, and then Kim and Sally, hopefully we'll get some comments. I imagine, especially since I brought up religion, there will be some comments. So if you can imagine, it is a very large church in Northwest Houston. There's a little bit of frustration here because the school choir is going to be singing at the funeral of a suicide victim. She was a cheerleader. The cheerleader's workout room has been made a shrine to the suicide victim. But I got to the funeral early, along with school administrators and along with school counselors. And we're looking at the casket. The casket she's going to be buried in has an exterior that allows kids to write their forever goodbye message to their friends. Most of the kids that were murdered at school This is the type of casket they're buried in. So what are the lead counselor and I doing? We're literally making notes and reading every single message that's written on that casket. We're obviously trying to get some insight into how kids are dealing with this, whether a number of kids are feeling guilty, angry, etc. And by the way, it's okay to say to kids, it's all right to be angry at your friend. She made a very unfortunate choice. And sometimes people will say, how could they do this to me? Here's my response. Suicide is not about other people. Suicide is not about revenge. We talked briefly last time about all the dangers of the Netflix program 13 Reasons Why, and the 13 revenge tapes that Hannah was mailing to her friends. Suicide isn't about other people at all. In fact, what do you say to survivors? They were not thinking about you. They were experiencing unendurable pain, which Schneidman called psychic. They had tunnel vision, they had constriction. Unfortunately, they did not see alternatives. Now we're looking around, and I'm back to my example of the church, and I haven't given you the denomination, but you're going to figure it out. So I'm looking around and haven't quite started yet. There's about 800 kids, and the lead counselor and I are saying, where are their parents? Their parents should be here with them, supporting their children through this funeral process for a suicide victim. Then the member of the clergy stood up and started their discussion and statements. And I'll never forget what he said. Her burdens were so great. Her burdens were so great. She had to come to God. If your burdens ever become great, you too must come to God. What am I wanting to scream? Tell them come to God through service, Bible study, worship. Don't tell them to come to God through suicide. So there's an example that's pretty frustrating. And how do we possibly avoid that? Talk to the family. Have you thought about the timing of the funeral? After school or in the evening or Saturday? Parents will be more likely to accompany their children. That is very important. And who's going to be doing the service? Could I possibly talk to them so that maybe they could include some prevention messages? And on one occasion, all right, please talk to the member of the clergy. Oh, why don't you talk to the funeral home and the cemetery? Because we have to have her buried before dark. So whatever adjustments they can make so it can be after school, the family was totally on board. But again, I think this only happens because of personal contact. All right, did I get any comments? Kim or Sally?
I don't see any on funeral specific.
Nothing related to
Okay.
that right now.
Okay, well, I'm going to go on, but we'll stop again at maybe one more time before, towards the end. Of course, we'll have time for comments and questions. This was the question I got, and I've actually given quite a bit of thought to this. This was asked as a result of the first webinar. What about healthy behaviors? What about non-healthy behaviors? Well, healthy behaviors would be understanding it's no one thing, no one person, no one is at fault. It is very sad. Healthy behaviors would be getting involved in raising awareness for suicide prevention. Here's a healthy behavior from Academy 20 in Colorado Springs. One of the teachers wrote a personal note to every one of 130 students in her high school classes, talking about attributes that she liked about them and encouraging them at this difficult time. Non-healthy behaviors. Sometimes kids want to keep gathering at the home of the suicide victim. I don't necessarily think that is a good behavior. especially if it involves their parents giving them clothing that belonged to their deceased friends. And now they start wearing that clothing. I'm aware of one kid who hung himself with the belt that he got from his deceased friend's family. I'm also aware of a small community in Missouri where the parents thought, let's just have a big bonfire on a Saturday night in memory of the suicide victim. Kids are there, parents are there, big bonfire, and everybody's drinking, kids and parents. So those are a couple that come to mind that are not healthy. The healthy ones would be trying to follow the recommendations that are in the toolkit. And again, just telling everybody, no one thing, no one person is to blame. And it's everyone's fault, yet it's no one's fault. And we all need to work together to support each other, increase suicide prevention awareness, increase funding for mental health, et cetera, et cetera. So where I worked, I approached the superintendent and I said, we got a lot of families that really are willing to get community-based mental health treatment for their children. And they don't have any money. They don't have insurance. I got him to give me a large pot of money. And when we had a kid who was suicidal and families that could not obtain needed services, we paid for them to see a psychiatrist that was well trained in suicide risk assessment and management and who might be able to access a hospital bed. Now, I'm pretty sure the day after I retired, that pot of money was taken away. And what did it take to get that? It took many, many suicides and much frustration. I think I pretty well answered all of those questions. How do we prevent further suicides? Knowing what to look for, knowing what to do, getting adult help, calling 988, staying with your friend, using the crisis text line, using the Safe Schools anonymous reporting app for the state of Nebraska. And maybe towards the end here, somebody could remind us of the anonymous reporting procedures. Very important. I think I pretty well covered this one. I'd be curious to know, maybe some of you think, I'm going too far to try to meet with the clergy, but we want to stop those messages about come to God through suicide. Practical suggestions. I've sort of put this together, and if you would think of it as almost like a checklist. And I think today I've pretty well covered every single point that is on those slides. Personal contact, truthful with students, talk to them about this, but in a group size no larger than a classroom. Promote all of the crisis resources. Do you know, the last article I read said 988 is great, and we do need to promote it more. The article said a lot of Americans still aren't familiar with it, and sadly, 84% of the calls to 988 were answered, but 16% were not, which we need more volunteers. Develop a policy and treat all student deaths the same. And encourage and allow students with parental permission to attend the funeral. But if we make it after school and in the evening, then we're not really dealing with these issues about who can leave school to go to a funeral. And another occasion comes to mind. A group of like 15 or 20 kids are really upset and they all want to leave school. And a mom is at school and says, oh, they can all come to my house. Well, all their parents said it was okay for them to leave. So the mom calls back. The 20 kids are in my basement. I don't know what they're doing. They've totally shut me out. See, we were providing support at school. And once they left school, they were largely left to their own devices, and they shut out all of the adults. Contribute funding. My favorite, living memorials. Let's do something in memory of the suicide victim. Leah. Leah was an 8th grader. She died by suicide. Kids got with parents, and literally the next day, 5 kids arrive at school with t-shirts. Princess Leah, there's her picture. You'll always be remembered. So the principal was like, I'm sending them home. I'm like, let's slow down a bit. I'd really like to meet with them. This is how they're expressing their emotions today. I think I can direct them to doing some other things in Leah's memory, and I believe I can get them to wear their normal school attire tomorrow. Social media. Wow, is this challenging? You know, the Surgeon General put out an advisory about social media. I would encourage everybody listening to read it. But what can we actually do? We need to get insight into what students are posting on social media. How could you do that? Well, you're a high school counselor, you got a really good relationship with kids, you bring a couple of them in that are really responsible. They're basically going to be your cultural brokers. They're going to give you some insight, show you what kind of things are being posted. You're going to help them post messages on social media about prevention, get adult help, gatekeeper role. And earlier, I was searching for some videos that I did that are on YouTube. And, you know, I put in my name and the message about helping schools and communities after challenging time. And the YouTube page came up. And that YouTube page was all about crisis resources. And when I scrolled down, I found the videos that I was looking for, and I'll call your attention to one of those in a few moments. But like the very first thing was about crisis resources and warning signs of suicide. Encourage parents to get more involved in the supervision of their child's social media. My favorite thing to do, and I did it here locally, for the Pembroke Pines Charter Schools, raising children in a challenging world. Virtually, I had over 6,500 parents. They didn't have to leave their home. They could put food in front of their kids, go over and turn on the computer. I mean, that's the largest audience I've ever had virtually. It is a difficult time to raise children, and lots of concern about anxiety, depression, and suicidal behavior for young people.